Would you like to increase your human performance potential? Would you like to be able to move better through life? Would you like to be more competitive in your athletic events while reducing your chances of injury? Or would you like to just reduce your chance of injury across the board? My name is Brian Schwager. I'm the founder of Wellness Movement Services, and I have an answer to these questions. These questions represent what I hear from my clients and more. And by the time they get to me, they have these restrictions. Some of them even have pain. And the most important thing that I can do first is first collect a detailed health history and then take them to a physical assessment, number 2. Right now, we have an ever-increasing risk for orthopedic injuries that have been on the rise. Let me show you. Solving the billion-dollar challenge, my clients come to me and they have these musculoskeletal conditions. And they've been to 1, 2, 3, as many 6 different practitioners over a period of anywhere 3 to 18 years. They've invested thousands of dollars only to have short-term relief. These statistics really boggled my mind. This goes back, I was seeing these musculoskeletal conditions back in the early 90s. And I seen it grow and grow. And it even concerned me because I'm in the fitness industry. My job is to help you to prevent injuries. Besides the fact you want to lose weight, you want to get stronger and move better. But my job is to reduce your chance of injury first, to do no harm. And I knew that I needed to go back to school to understand this better. 1992 to 1994, 1991 to 1994, I worked for a sports medicine clinic. And this is where I was first exposed to the importance of assessing. Now, of course, this was after the fact. People are already injured. Of course, they're going to assess you. But I started to think, what if we did this beforehand? And it was apparent that we needed to, because the 2 leading predictors to injuries is a previous injury, number 1. If I was going to a personal trainer and they asked me about my health history, how many injuries did I have? I had 7, not counting all the concussions that I had. And even if I didn't have pain that day, right? So let's say I don't have any pain, but I've had all these injuries. That's the first thing I got to rule out, is I got to rule out the chances of that coming back. And the only way I can rule that out is to check for muscle imbalances, which is the second leading predictor. We look at the 10 musculoskeletal health risk factors right here. Look at the first 2. So if I ask you, how many have you had a previous injury? Do you know, are you aware if you have any muscle imbalances? I guarantee you, if you've had a major injury, like I had a couple of major ones, there was scar tissue afterwards, and there were other imbalances that were not addressed. Yes, they did the best that they could with what they did with my injury at the time. In the late 80s, I had a back injury. In the middle 80s, I had a shoulder injury. And I had countless other injuries as a mixed martial artist going through the 90s. But when I went back to school, my first case study was me. And when they did the assessment on me, was I surprised? I thought I did a pretty darn good job keeping myself in shape. Hell, I was competitive all the way up until the middle 90s. But obviously there was something missing. And what was missing is a proper assessment and restoration process. So what we're going to show you today, what I'm going to show you today, we, meaning all the people in this video, we're going to show you the importance of getting assessed first. Now, the purpose of this video is for people who do not have pain. I have a whole different assessment for everybody else. But to drive it home, We have an orthopedic dilemma right now in 2023, and it's growing. We know statistically that 1.71 billion individuals worldwide have a musculoskeletal condition. 568 million of these cases are low back pain. 1 in 2 adults experience musculoskeletal pain. And did you know that 80% of those can be prevented with lifestyle? We're not going to get into that section here, but that's why I have my 4 principles. Principle 1, 2, and 3 here are lifestyle factors. What we're discussing today is how we're moving. That's mainly principle 3. I started to notice when I was working clinically between 2003 and 2008 that there were a lot of patients coming in that were getting injured while taking classes or working with trainers. Now, I already knew at the time in 2003, I had already enrolled and went back to school. And my schooling is right here. Now, before 2003, I was certified as a personal trainer through the American Council on Exercise. I also had a specialty in mind-body integration, and I took many other courses between 2003 and 2008, besides what you're seeing here. And what I'm saying is, I took the best from all of what I learned and created a protocol, a system, an assessment system, a corrective exercise system, and then later a functional training, strength and conditioning system. So when you see me taking people through the basic physical assessment, the tests within the assessment are from a variety of different methods, systems, and concepts. In a basic physical assessment, I do a full postural evaluation. I do comparative joint range of motion and flexibility tests. I use the famous functional movement screen. I do static and dynamic core function tests and applied kinesiology tests. Let me explain a little bit of this here so that when we get into the video, I can just move right through it. First, let's talk about the functional movement screen, which is within my basic physical assessment. In 2004, I went to a workshop put out by the Functional Movement System, where I became a functional movement screen specialist, level 1, and later became a level 2. The people that invented this created for the first time ever in the fitness industry a way of rating and ranking movement, checking for movement competency. How well are they moving? And mainly, how well are they moving from side to side? As you see in a lot of these tests, it's a measurement from side to side, because if there's an imbalance, remember, that's your second leading cause of injury. But the people that invented this, they came up with a way of rating it. Then they researched it, and they put it through the litmus test for years, and the results were hands down. So I immediately said, when I learned this and I found out how well it worked, because I took it back to the clinic where we put it to the test, it worked. I said, I'm adding this to my protocol because this is really good stuff. Misnomer about the core. So people think the core is just around where the rib cage is, and they're sadly mistaken. I've asked personal trainers where they think the core is, and less than half of them had it right. Everybody else thinks that this middle cylinder is your core. Sure, it's the middle of it, but your core starts up here at your chest and goes all the way down to your hip flexors. That's part of your core. That's the front. Now the back side goes from your upper trapezius, these muscles up here, all the way down to your glutes. Your glutes are part of your core. And what we find is that one glute is weaker than the other, one chest is tighter than the other, and this rib cage muscle here called your obliques, one is tighter than the other. So if we're not restoring that first, the tighter side gets tighter, the looser side gets looser. That's just the outer core. The back side of the core, the front side of the core, that's just the outside. Now let's peel back the layers and let's go down in deep. Now, if I were looking straight down, here's the spine. Deep inside, that circle around your cylinder is your deep core. That's the one that matters. That's the one that really promotes spine stability. Do you know that more than 70% of the people right now, anywhere in the world, have an undiagnosed spinal pathology? And what that means is they probably have an instability somewhere. Instability, loosey-goosey, 70%. I back that. I've had people come in with no pain at the beginning of an assessment. And as I got towards the end, oh, I felt a little something. You know, they felt a little pain. This wasn't until like 3/4 of the way through. Now, I knew on their health history, and this is one example, a former downhill skier had all kinds of problems, and she was also a running athlete, had problems with her left knee. Orthopedic surgery, physical therapy, more physical therapy, more physical therapy. It got better, really didn't stay better. She came to me, no pain. Got about just past the halfway point of my physical assessment, pain. I sent her over. This is while I was working with that chiropractor. And we found out that she had 2 instabilities in her spine that everybody else missed. I said, that's why you never really got better. What I'm getting at is core function. You know, doing a plank is not just the only way you can test your core. It's a great measure of capacity. I do implement it. But what I want to know is what is that inner core doing? Because it's on its own wavelength altogether. Okay, look at these different postures: sway back, military back, flat back, kyphotic, lordotic. Kyphotic is really a flat back. So this flat back here is more kyphotic. And then forward head. Now, some people could have this posture here and this one built into the same one. Okay. Well, what I'm getting at here is there's a corrective exercise strategy that's different for each one of these postures. Which one do you have? Were you assessed prior to this? And not only from the side, but from the front as well. So when we look from the front at our posture, we may have a tight chest muscle, let's say here on the right, and a tight hip flexor on the left. Now that would be an abnormally normal posture. But what if they're on the same side, which I started to find in 2010? Now I started seeing this clinically, but I was having people come to me with no pain and they had the same pattern that was different. The whole point is here, ladies and gentlemen, these things that are missed and not corrected is what's keeping you cycling back to the physical therapist and the chiropractor. There's nothing wrong with going to a physical therapist. I mean, I did. But the point is, after physical therapy, are we continuing to go backwards in these patterns? Or, like what my patients did, is when they came and seen me as a trainer, I understood where the physical therapist left off. I understood what the chiropractor was trying to do. I was doing this in the 90s. I was networking with chiropractors. And I was identifying with their imbalances that they were finding on their patients, and their patients were seeing me as a trainer, and I was coordinating my exercise protocol with what the chiropractor was doing, so I would not undo their work. Now, this really came to fruition when I worked with that chiropractor between 2003 and 2008. That's where I learned about these postures. Going to another workshop where I learned about this, then we applied it. See, the thing is, if you don't know, then you're left with a deficit. So a client comes into me, had been working out off and on for 5-6 years, and I'm seeing gross imbalances, Everybody's got a little bit of an imbalance. And what I want to clear up right here is nothing in here has to be perfect. You're already perfect. But what we're trying to do is we're trying to get your movement and your posture and the rest of your function to be ideal, so that when you go out into everyday life and you go out and to play a little bit of tennis or whatever you're doing, you don't exasperate this situation and make it worse, because that's what puts you back in the clinic. The most important thing we have to do as fitness professionals is we have to restore you enough so you have everyday functional strength capacity. That's the primary emphasis, number one. That's survival. My clients have to get in and out of cars. Some of them have to climb ladders. Some of them have to pick up kids. Some of them have to move rocks. Maybe they work in their garden. Maybe they have a job that requires it. Maybe they're pushing a stroller. Maybe they're pushing furniture. Maybe they're moving something, pulling, pushing, twisting, bending, lunging. Everyday life requires these 7 basic primal movement patterns. What are they? Squatting. You got to squat to get out of a chair. Bending. You got to bend over to pick up your child. Twisting. You may have to twist to get something, or maybe you're backing out of a parking space. Pushing. Pushing a cart. Pulling. Pulling a cart. Lunging. Well, you got to get down to tie your shoe. Go up a flight of stairs. And a variance of gait, whether it's walking, running, or sprinting, get those established first. Once we have your primal movement patterns ideal, the rest is easy. Oh, but I want to play tennis. Well, then I have to add a little bit more to your exercise protocol to get you ready for tennis. Brian, I'm a firefighter. Well, I got to add a little bit more to your protocol now that we got your base set, so that we can build off of that so you can use your strength capacity for firefighting. Brian, I'm a MMA athlete. Brian, I take ballet. Brian, I go to yoga. Brian. I want to know what your dream is. But I also want to know where your imbalance is in, and then get those imbalances set first. Get your base, get your base set. Your inner base, remember the inner core, your outer core, your posture, your movement. So you have your inner and your outer base of support. They're set. Once they're set and ideal, let's build off of it. Let's build a fitness program to match your dream. So now, before we get into the video footage, which I'm going to narrate you through, you're going to see one is my mentoring student and a client. And then he'll be working with a couple of his case studies, and then I'll have some other clients in there that I'm assessing. So there's going to be a variety of different clips from a variety of different years, and I'll kind of point that out as we go along. So I want to give thanks to all of them for volunteering or letting me use this video footage for educational purposes. Okay, a few things before we get into the video footage. Number one, you're going to see my mentoring student and client, Joshua, at the beginning. And then I'm going to be videotaping him. I did some videotaping when he was working with this case study, so I have footage from that. And then I'll have a couple of other clients in there that I did assessments on, so I can show you examples. All of them did well. All of them cleared the assessment process. And again, this is the basic postural assessment. There's a couple of snips in there where I was taking some of the assessments out of the video footage, and these were clients that were actually coming to me in pain. And I'll point that out to you so you can kind of get the difference between them both. So the first thing we do is we have the client march in place. 6 steps. Now, why do I do that? There's a variety of reasons, but number one, with their eyes closed, marching in place for only 6 steps, that will level out the postural playing field. So in other words, if he knows he's going to have his posture done, he's going to stand there and try to straighten himself out, and then I'm going to observe and see where the indifferences are. But what I'm doing here, he's got his eyes closed, he's going to march. When he's done, he stops, he opens his eyes, but he does not move. wherever his foot lands, wherever his shoulder is, wherever whatever is, he's not going to move it. That's going to be representative as his authentic posture, not something that he tried to self-correct before he had somebody observe it. Up against. So you see how the arrows are going down to the right here. So obviously we have muscles that are short and tight on one side of the body and the head, in this case in the neck, and they're long and weak on the other. When we have these postural imbalances that I talk about, and I'll go over with you, basically it's this a length tension relationship imbalance. So one side of the body short and tight, the other side's long and weak. And here, down here in his hand, where I have his arrow going inward, you'll notice that his hand is turned in more on the left than it is on the right. That's indicating to me that the chest muscle on the left is tighter. Now, which one is it? Doesn't matter to you, does it? But it does matter to me. Is it a pectoralis minor or is it a pectoralis major? Doesn't matter to you, but just to show you, I'm just covering the bases. You go down to the foot, you see his foot is more pronated on the left. And when he stopped marching, his left foot was forward. Now, those all mean something to me. But basically, the pronation of the foot is indicating a weaker glute. Is that the only thing that's causing that? No. But I'm just kind of giving you an idea that when we have these imbalances, the number one leading cause for an injury is a previous injury. Yes, he had a number of them. Number two, muscle imbalances. I don't think they were able to really correct or help his injury because I'm still finding a lot of imbalances on him. He went back to working out, CrossFit, and all kinds of other athleticism type exercises, and all he did was made the tighter side tighter and the weaker side weaker. So once I have a static posture assessment done, now I have some benchmarks. You know, I'm looking at the framework. How is it sitting on the body? Now we move into the functional movement screen, where we still are testing. Some tests are done close to the ground, and some tests are done standing. Most of the tests are testing from left to right. You see here the inline lunge and the hurdle step, whereas the squat, the pushing pattern, those are just symmetrical, but they're also going to tease out imbalances, as you will see. Now, the functional movement screen was the first rating system in fitness. Now we have a way of rating and ranking movement competency. And here's the scoring criteria, completely perfectly as verbally described, a score of a 3. Completed with compensations, a score of a 2. Unable to perform the pattern as described, a score of 1. If there's pain with movement pattern, a score of a 0. That's when you would refer out. Luckily for me, because of my extensive knowledge, if they got pain during the FMS, then I just changed the protocol, take them into a comprehensive physical assessment. A total score, 7 screens, 21. I've had a few clients get a perfect 21 after they cleared it, with no asymmetrical differences observed between one side of the body and the other. The goal is to score at least a 14. Reduce risk of injury with physical activity. Any score below is an increased risk for injury. So my job is to get a baseline and then create a strategy to bring that baseline up. Now, this FMS is used in professional sports and with a lot of organizations that have a high demand for accuracy. That's how accurate this thing is. The evidence is in, and it's just hands down, it's a really great tool. Let's take a look. Now, the first test is what they call an active straight leg test, an active straight leg raise test. Now, most people think that this is testing hamstring flexibility. It is, but there's a lot more going on. It's also testing core function. It's also testing joint function of the hip. So let's take a look at what he does from side to side. The objective here is, you see that little bone on his ankle down here, the lateral malleolus, that has to line up with this dowel. And you'll notice in him, the differences weren't that great. When they did this on me, the differences were greater. I was a lot tighter on the left side compared to the right rather. But let's take a look. Now, his ankle bone clearly goes past the dowel on the left. And what I'm also looking for is unusual movement to the down leg. Is there unusual movement going on in the trunk? In other words, is he using muscles he doesn't need to get his leg up there? Now watch what happens on the right. He struggles a little bit more, barely makes it to the dowel. And even there's more of a knee bend on this side, which is indicating his hamstrings are a lot tighter on this side compared to the other. But I'm not there yet. All I'm going to give him is a 2 with an asymmetrical indifference that is not that great, but I'm going to give him a 2, and I'm going to check those hamstrings later in another test in comparative range of motion. Let's move on. Now, this is the rotary stability test. This is an unusual test. Now, what we're looking for here is one side of the body is going to be doing the moving, and the other side is going to be doing the stabilizing. On the stabilizing side, he has to keep his toe against the board, knee against the board, thumb against the board, and try to get his arm and his leg to be in line with the board as he does the test. Now look at the difference from left to right. Here he's going to be moving his left side and showing stability on his right. So he has to maintain stability on the right. He goes out, he goes all the way back, touches, goes all the way back out, pretty darn clean. Now look what happens on the other side. He goes out, he goes in, and he loses his balance. So we do the best of 3 tries. He got 3 attempts. This side was actually a 1. The other side was, I'm going to give him a 3. He probably teeter on a high 2. I'll give him a 3. Now, trunk stability test. There's a variety of different positions for people. I'm sorry, for males and females. And for males, it's going to be a lot harder. For females, it's a little bit easier, but the test is still hard. Let me mention something here. I know already you're probably thinking, how am I going to take a senior through this? I don't. I modify my functional movement screen and all my tests to meet the age group. So don't worry about that. I've taken 60, 70, and 80-year-olds through a modified version of a functional movement screen or some sort of a movement assessment. So no worries there, got that part handled. Here's the objective. He has to lift off the floor without any hesitation, like he's holding a plank. So in other words, there should be no loss of movement between his shoulders and his hip. He should come up like a straight plank. And he nails it. So he gets a 3 on this test. Now I'm going to show you an example of what it would look like if somebody didn't do quite as well. Now this female, already her shoulders are exceeding her hips in elevation, plus her right hip is dropped. So she's got a rotational deficit, and she's got a lag. In other words, when the other guy came up, he came up like a plank. There was no lag between his shoulders and his hip. That's called proprioceptive lag. So the communication between what the brain is telling what the core is to do is very slow. And again, this young lady, her sports background is cross country and ballet. She's now a mother of 2. She came to me before she had her first child. Took me a while to get this trunk stability push-up. I worked with her chiropractor and her massage therapist closely, but eventually we got it. Now, this is a shoulder mobility test. This is my mentoring student with his case study. Now look at the difference with his left arm over versus his right arm under. He's going to measure the difference. And there's a scoring criteria for this. Look at the difference here. So now at this point, this guy, interestingly enough, did not have any pain. He didn't report any pain, but we do have a big difference between sides when it comes to this mobility test. And there is a standard. I'm not going to go over all of the standards because it would belabor the point, All you have to see is that there was a great asymmetry from one side to the other. He got to the trunk stability push-up and he got pain. So I was there, of course. I took over. Joshua stepped back. And eventually this guy came into he was my client for about 6 weeks, sent him to my chiropractor, got him pain-free, and then I referred him back to the trainer. But look at the difference from one side to the other. Now, the inline lunge. Remember, we have 7 basic movement patterns in life. In life, do you lunge? Sure you do. If you go down to tie your shoe, if you're going up and down stairs, and who knows, different precarious positions for different jobs may require you to be in a split stance position and go up and down. He's got to maintain good upright posture. That dowel is touching the back of his head, the back of his upper back, between his shoulder blades, and right between his glutes and his low back is called your sacrum. That dowel has to remain in contact from point A to point B, and he should have very little movement from side to side. Watch what happens when he switched legs. Now, he maintained good dowel support, but look at here. Already he's losing his balance. He maintains good dowel support, but he struggles from side to side. Side to side motion, so if you didn't know, that's a frontal plane imbalance. And what I do is I determine the plane of motion that's the weakest, along with the other things that were scored the lowest in all the tests. And I would say, like for him in my report, I said he needs to increase his frontal plane stability, then his sagittal, his transverse plane, which is rotation, then his sagittal, which is front to back. Somebody else, it might be the sagittal plane might be the priority. Frontal plane might be second. Transverse plane might be third. That's how specific I get. Now, again, he has big goals. He wants to rock climb. He wants to do CrossFit. He wants to do other kinds of gymnastic type movements. Activities that he wants to do is going to require a lot of balance and a lot of stability. So the higher the goal, the more extravagant, I should say, the long-term dream, the more corrective and functional training will need to go into that person's exercise system. Now look at right off the bat, watch his left hip. Look at how his left shoulder had to come down, his right hip had to go up to make that foot over the hurdle. You won't see that as much on the other side. Watch on the way back. He's got to really crunch back to get that. Now watch his side. His side, he's fairly level. He didn't have to drop the shoulder as much, and the hip stayed level. These are all the little things that I look for, because after I've recorded this, sure, I go over the basic results right away with my client to give them an overview. But then I take this into my office, I slow down the videos, I look at everything carefully and make a final report. And then I develop the corrective exercise strategy. And my job, remember, is to get him through that as quickly as possible. Let me just reiterate something here. My job is to assess, restore, correct, strengthen, and get you back to activity. That's what I was trying to say. You know, it's not a belabored process. Yes, it can take a little longer depending on what you're bringing me. But believe me, I know you want to get back to what you want to do. It's just that based on how long you've had the imbalances and whatever you're bringing me, I have to undo all that. Some people it doesn't take that long. Some people it takes a little bit longer. Now, a squat, he did awesome. Look at that. He got all the way down. He breaks 90. He's got a nice, what they call a posterior hip position. Now, I didn't include all the videos, nor am I including everything in the test, the basic physical assessment, I should say, because it would take too long to go over everything. But from the front, I noticed he had the same dropped arch, but only it was more when he did the squat. Remember, like I said, in a static posture, it's one thing. I saw his left foot pronate. But when you move, that compensation gets extenuated. So when he was going into his deep squat and I was looking from the front, that left foot really pronated a lot more. So it was telling me something. The other thing I'm noticing is that his left arm is rotating towards the right. And you could see it plainly right here. And then I pointed out to him, show him what he was doing. But he basically cleared that test. He got a 3, just some little nuances to clean up. Now here's an example of how it would look otherwise. Now I should go back here. Let's go back to Joshua for a minute, because he's got the perfect deep squat, right? What we're trying to do is line this dowel up with his foot. So anything above the big toe to the ankle bone, as long as that dowel is lined up into the footprint, he's good. Now let's go back. So you can clearly see she has a hard time getting the dowel back and over her footprint. That's pretty obvious. Got some pretty tight hips going on, some other things getting in the way, or psoas, blah, blah, blah. It's never one thing. I've had trainers come in and shadow and say, well, it's a tight hip flexor, or it's a tight piriformis, or it's a tight lat. It's all of it. We don't look at muscles here. We're looking at patterns. We want to restore the entire pattern and not work on individual muscles. That's where we went wrong from the 60s all the way. I got to say, even currently, they're still in an isolated model. They're not looking at movement systems or movement patterns in this case. So when somebody struggles, what we do is we ask them to put their heels up on the board. And what that does is it gives the ankle a little bit more motion. And you're going to notice it did change a few things on her. The first thing it changed is she was able to get deeper. Now, I didn't do much for the dowel, but I know that ankle mobility is part of the challenge here. And you wouldn't realize how much ankle motion you need to lunge and squat. You clean that up. They cleaned my ankle motion up, and my squat got better. Now, of course, we had to do some other things to make it even better. But the point is, I looked at that and went, wow, all you guys did was clean up my ankle mobility, and already my squat was looking better. Point is, what are we getting so far? You're learning that these have to be seen before we get into regular exercise. Right off the bat, this is something a little extra I do. Depending what the client is giving me, I did a little extra look at this gentleman's, I believe this is Joshua, at how their scapula, your shoulder blade, because it has to move when you raise your arms up. And you can already see this right side is further out compared to his left. And his left side, he has a little bit more shoulder winging. So let's take a look at this. Now watch it again. I'm going to measure, and definitely he's tighter on the left. But you'll see it here again. Watch here. Now it's really apparent, because I had to move his arms in a little different position. His left side lags behind compared to his right. Your scapula is supposed to come around your ribs. This is your thoracic rib cage right here. It's supposed to come around. And it does here on the right side, but it gets crowded and tight, and that will affect shoulder function. So if you've ever had pain in the front of your arm or out here when you raise your arm overhead, one of the things that is not working correctly is that scapula. That scapula has to have a certain amount of timing and motion in order for that arm and that shoulder to function properly. Don't guess, get assessed. Now, this is a case study for Joshua. This young lady is a yoga instructor. She is a movement artist, really. And she has some other kinds of dance background. Now, what I'm checking is ankle mobility. Remember we talked about that in the movement screen? Now I'm getting to comparative range of motion. What I ask the client to do is move their feet. And then when they're done, I look at the difference. Then I tell them to relax, and then I move it. That's called an active test, which she's doing now. And then what I'm going to do is I'm going to do it passively. She's going to relax, and I'm just going to check and see. Now, a client can do it actively, and let's say actively they were tighter on the left. But then when I test it passively, they're tighter on the right. Well, this video is not to go into detail as to the why behind it, but believe me, I will understand the why behind that. Because if I don't, the tighter side gets tighter, the weaker side gets looser. We really don't get any advantage. Now, with the foam roll under her knees, I was checking the lower calf. Now the foam roll is out from under her knees, and I'm checking her upper calf flexibility. Again, passive and active. And then, of course, Joshua would jump in and he would do these, but I don't have that part videotaped. Thighs, which thigh is tighter? First, she does it. Well, you can already see her left one's tighter. And then, of course, I do it. How about her hip flexors? She's a dancer. She's quite flexible, though. In fact, she's got a little bit too much ligament laxity, if you will. She's hypermobile, just like the lady that was squatting. Didn't seem like it when she did the squat, but in some of her joints, she's got too much motion. The hip piriformis, checking from side to side. Now here, this is applied kinesiology. This is a muscle test. So I'm checking for muscle strength from side to side. And you can obviously see, I'm going to turn this back on. Watch how low her right leg goes when I push on it. Look at that. But watch her left. She's rock solid on her left. Again, sometimes I go down the rabbit hole a little bit. Sometimes I have to. I may see something in one part of the assessment, and I'll have to look a little bit deeper in the other part. I leave no stone unturned. That's what they're investing in. They're tired of going all over the place and not getting an answer. They're coming to people like myself, check practitioners and others, that are really into the quality and the higher standards of assessment. Now, this powerlifting athlete, he's a case study for another mentoring student, and he had some rotational differences that I needed to go down the rabbit hole on. So I had him do a standing and a seated rotational test to see how far he can rotate from one side to the other. So he goes pretty far to the right, but when he goes to the left, he struggles just a little bit. Let's see if the same thing happens seated. Goes to the right, good range of motion, and he'll struggle a little bit when he goes to the left. See? So it was the same, whether he was standing or sitting. So that's good. I know that he has a flexibility problem with rotating to the left. If it was different, that's a different modification. That's a different strategy. And they happen. And I learned all this, these indifferences, what they call a functional asymmetry. I learned a lot of that by taking these advanced courses and, of course, working with that chiropractor, who I just call a chiropractic neurologist. All right. And then there's different ways of testing hamstring flexibility. You remember the active straight leg raise we did at the beginning of the video with the young man on the floor with the dowel? Well, this is more of a scientific approach to measuring the actual hamstring flexibility itself. Now, on this test, I'm testing a specific part of the hamstring, starting with his leg up, his hip bent, flexed, if you will, and then he'll extend his knee into the air. And I use my goniometer in this one, and I measure the difference from side to side. And now another form, this is interesting. Here I had already moved to Jacksonville, didn't have my studio open. I had a client flying in from Arizona. This is a surfing athlete and quite a fitness enthusiast. And he rented an Airbnb, and I brought my equipment there, and I did the assessment right there. This is what we're going to call a hamstring flexibility test. And my hand is going to be under his low back. Now, the first part of the test is going to be active. He's going to do the test. And then the second part of the test will be will be me performing the test. And when I get to the second part where I'm actually moving the leg, I'm detecting how soon his back flattens to my hand. There's a reason for that. But anyway, let's take a look. Keeps his foot in that position. And then I ask him to raise his leg up. And I get a visual. And then I compare it to the other side. Still checking for low back motion, and his left side was tighter. Now watch here. Now, the minute I feel his back hit my hand, that's his true hamstring flexibility. Remember how high he was able to raise his leg? Watch here. I'm going to double check, make sure I got it. And there it is. So that's when his back started to flatten to my hand. That's way different than his ankle being right above his hip, isn't it? Wait till we get to his left side. That one's even tighter. Look at that. So he asked me, he goes, well, how was I able to raise my leg and not have a problem getting it all the way up there? I said, and he's compensating to get it up there. But when I put his back in the right position and I actually test his hamstrings by itself, we have tightness. And there's a couple of other reasons why that's happened. Trust me, this guy cleared everything. And by the time he cleared this one, this was actually a comprehensive assessment. He cleared it within, I forget how many visits. And then I moved into my office, and then we finished with the basic physical assessment. And he was one of only 5 that got a 20 right away on the functional movement screen. So no problem, we got it. Now this female here came to me with some pain. So this is a part of a comprehensive physical assessment, but I still do this range of motion assessment with clients with no pain, especially females. Look at the difference from one side to the other. That's not good. And she came to me with hip pain, low back pain, had a child. I think the child was already 2 or 3 years old at the time, and had failed attempts, tried different types of therapies, tried trainers, and then heard about what I did. So again, we do it actively first, and then I'll come over and check it passively. And then I check it the other way as well. So here I do, she's tighter on that side when I go to across the midline. And then I check it seated, because when you're lying down doing a test, you don't need much stability, do you? Because the table ain't going to move. But the minute you get upright, whether you're sitting, standing, half kneeling, etc., the core function changes. So does the function of how stability is recruited. Luckily, her tightness was the same as it was lying down. So she did not have an asymmetrical indifference from loaded to unloaded. Unloaded is lying, loaded is sitting, kneeling, or standing. It was tight whether she was loaded or unloaded. So this is a good thing, because then it's just a flexibility challenge, which we cleared up. What about dynamic core function? This is a multi-directional lunge. What we're looking for is how much the client has to struggle in doing the pattern, just getting into position, and then doing the test itself. You see here, there's a lot of instabilities, but when she moves to going backwards, which would be hard just about for anybody, her proprioception and her vestibular balance was a little bit more challenged. I'm noting all of this. And again, we're going to clean all this up in her corrective exercise system. Now, he was lying flat down. He arched his back into the air, and he's going to hold it there. This is a core strength capacity test. And there are standards based on age. The younger they are, the higher the standards. They have to hold this position and hold the form. The minute they start to falter, the minute they start to shake or their shoulders come apart or whatever, the timer stops. This guy did really well. So that's core strengthening. Anytime when you're going to use the spine to move, that's core strengthening. If I was doing an exercise where I didn't want my spine to move, that's core stability. Here's a really interesting dynamic core functioning test. Now, this is going to be a combination of of a righting and tilting reflex and core stability, because I do not want his spine to move. That's why the dowels are on his hips and his arms. I'm trying to see whether or not they move around from side to side. But because he's on a stability ball, that's a tilting reflex. But his feet are on the floor. That's a righting reflex. So in life, when somebody is walking on a slack line, which he likes to do, or somebody gets on a surfboard, or somebody gets on an escalator or a moving sidewalk, that's a tilting reflex response. If you're just walking across the ground and you lose your footing, that's a righting reflex. And that's why I ask my clients, what are your goals? Like my surfing athlete, he needs a lot more tilting reflexes than he does righting. But my 75-year-old, she needs more righting reflexes than she does tilting. All right, so let's take a look at how he does here. So what you do is you translate to your shoulders off the ball, and I'm trying to see whether or not that dowel stays level. And when he goes to the right, he has a lot harder time negotiating pelvic position. So it rotates. And I can make the test harder. And some of these tests are given to the client as an exercise. Others are not. There's reasons for that. So some of us have done hip extension work with your feet on the ball. Well, look what happens here. Now, this woman here, this is our same lady we saw earlier. What a trooper she was, and she still is. Her arms are out. This is the easiest position to perform this test. But watch what her lower body does, and then watch what her hips do. You see how her hips are pushing to the right, but her lower body is rotating to the left. See that? There it is. Okay. I'll move her arms down. Let's see if that makes a difference. Nope. Now, the closer your arms are to your body, the harder it is, because your base of support gets narrower. Now here, not only am I looking for her extension, but I'm going to ask her to draw her heels towards her butt, like a hamstring curl. And I'm checking for a bunch of other things: core function, loss of postural positioning of her lower back. Is she rotating from side to side on the ball? Watch. She has a hard time negotiating this, even with her arms out at a 90-degree angle. And then I get down on the floor and check core function. What happens? Does her back fall out? Does it round out? Does it drop? Does she have a hard time maintaining that position? Does her feet go to one side or the other? Same with this guy. His feet wanted to go to the left. See that? He maintained good core function, though. He's got a loss of frontal plane stability. He even loses it a little bit more because his hands are closer to the ground. He still goes to the left. And we talked about the inner and outer core. And here's an inner core test. That little blue pad I'm laying down here, that's like a little pillow. It inflates. And then my hand is holding onto the pumping gauge. Sort of looks like a blood pressure cuff. This is the test, his inner core versus his outer core. I'm going to pump that gauge up. And then I'm going to instruct him to pull his belly button up towards his spine and watch what his back does. See how he has to tuck under to make that happen? I gave him no other instructions other than to draw the belly button in. I'm not going to give him the answers to the test. I want to see what his body does to negotiate the instructions I give him. That goes for any test I've done to my clients. I don't give them all the details. I'd be like giving you the answers to the test before you go in and take an exam. Now, the core function's different on your hands and knees, but the action was the same. The minute I asked him to activate his core, he rounds off his back. And I will say here that I'm testing inner core function. A couple of the tests that I didn't include in this video is checking for diaphragmatic breathing and breathing rate. That I'll have to save for another time, or go to my blog There's articles on there about the inner core, about the diaphragm. The diaphragm is also a spine stabilizer. And if we don't check the diaphragm, I mean, I've done these tests on people, athletes and patients and so on. And they've said to me, nobody has ever asked me about my sleep, did a breathing test like you did, or any of these core function tests. Now, in life, we're taught to brace our core. So if I ask you to tighten your core, that's not a problem for you, right? You can tighten your abdominals, but put your hands on your belly and just tighten your core, and you'll notice that your core pushes out, but it gets tight. Well, that's called ab bracing. And that's what we used to teach in the 80s, 90s, and they still teach ab bracing to this day. It's not, to me, based on what I learned at the Czech Institute, it's not the most efficient way to stabilize your spine. By drawing the belly button in, by sucking your belly button in, I'm just using that term so you get a visual, that's a far better way to activate your inner core. So here he takes a breath in, and I asked him to tighten his core. The first one, and what I'm going to play here is the first one he did, he braced, but now I'm going to teach him how to do it right. He did that. We call that ab bracing. Ab bracing. Take a deep breath in first into your belly. And then exhale all the air out, contract like you did before. That's now, better. You got a good contraction there. I want you to continue breathing, but you won't be able to breathe as deep. Keep the muscles tight. Take little breaths in and out. So I'm asking, him and his brain, can you maintain that position and still breathe? And that's difficult for people. Most of the time, I don't even get their inner core to activate. I was one of them. 2004, had my inner core tested. Hey, I did millions of crunchies and all kinds of core work for being a martial artist and a skateboarder, and mine was turned off, surprisingly, right? But when he wants to exercise with me and he gets to more advanced exercises like pushing and pulling and squatting and lunging and whatever, he's got to be able to, use oxygen and keep his core on at the same time. That's like walking and chewing gum. But I can reprogram his nervous system, build new memory, because what we're dealing with here is a cybernetic biological organism. That's your human body. It's cybernetic. It's a system of systems. It's like this computer. My iMovie is working with my Zoom, working together. Well, if I send a message to his brain to draw in, maintain contraction, and breathe, he's writing new software. He's writing a new program. And he goes home and practices that for 10 reps every day. And repetition is the mother of skill. As long as the skill is done right, you're building a new pathway. Isn't that interesting? That's why phase 1 is all reprogram and restoration. Keep the muscles tight, take little breaths in and out. Now, in life, you're going to move around. Now, again, I know we're doing all this close to the floor, and there's reasons why. But as he works with me, I'll get him away from his back. I have to. I got to get his core to function in all positions, not just in this position. But here I'm going to ask him to move his leg. And as he moves his leg, will his core remain in the right position as he lowers it? Now, your leg weighs 10% of your body weight, just one leg. So I'm imposing a load to his inner core, and I want to see how he negotiates this. So he brings it up, keeps the heel down. I don't want to make it too advanced. See how much easier that is? He's got to maintain activation as he lowers. I have my hand under his low back. I have my top hand to monitor his core, and his back moved as he lowered his leg. We don't want that. I want his back and his core to remain in one position as his hip rotates. That's called hip low back disassociation. And once he gets that, and he can do rep after rep after rep, then I start putting him in more precarious, or what I call I increase the level of difficulty, and before you know it, this guy's able to do a split stance lunge, maintain core position, blah, 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 and it's all written in his software. Remember, the point is to get him back to activity as soon as possible, but not to leave things undone. That's what causes long-term problems. That's where we're at right now in 2023. We have just patched people up, the clients that have come to me, and they want a resolution to this back pain, neck pain, performance challenge, whatever it is. Now, again, even the people that don't have pain have dysfunction. And they go to chiropractors every month. They go to massage therapists every month. We won't count the people that have gone to physical therapy. That's a different classification of people. Maybe they had gone, right? Then they were better. Then they maintained their massage, but they still kept having problems. That's when they end up in my office. Now, here I'm going to be working with a woman. She had just recently had a child about, I think, 12 weeks prior. And she's a case study for one of my mentoring students. And I'm going over this test, and then my mentoring student will jump in and do the test on this young lady. So I think now you're beginning to see how important it is. I don't think I have to go any further. How important it is for us to get assessed. So I hope this helps a little bit more with the value of getting assessed before exercise. I hope this helps to drive home the importance of restoring imbalances now that you can visually see that we have them. It doesn't matter. I went through all of them when I first moved to Asheville, North Carolina in 2003. I enrolled at the Czech Institute, flew out to San Diego, California, and was assessed to the 9. I mean, talk about detail. Then I flew out and got the whole functional movement screen done, and I had a plethora of imbalances that I never knew I had. And until I've done it on myself and restored myself, how can I be valued as a qualified instructor? You remember, I got out of the industry for 7 years and spent 7 years in school. I'm still at the Czech Institute enrolled as a student. But for those 7 years, I had to bring up my competency. I worked with this chiropractic neurologist, this functional nutritionist. It was a benefit to my career before I opened up what would have been my 5th location. I opened up my first one in Asheville in 2009, and the rest is history. If you want to learn, if you want to get this done, you want to learn more, you want to get this done, maybe you don't even live in my geographical area, but you want to know more, all the contact information will be located at the end of this video. Hey, I love sharing because I share because I care, and I want to empower you with the knowledge so that you can take control of your wellness and movement. I'm Brian Schwager saying, have a beautiful day, stay empowered, and get assessed before you exercise. Bye for now.